Today we're talking about pharmacy issues and support for thyroid patients. We know that the pharmacy experience can be confusing for thyroid patients between inflated prices, insurance coverage, changing medications, etc. We know that it can be sort of a complicated, unknown experience for patients. And so we're sitting down with Dr. Jessica Nuvandi and Dr. Donna Mazzola, both of whom are pharmacists and have a lot of experience on either side of the counter. And they are going to share with us today sort of a deep dive on some of these topics related to the pharmacy experience. This event is hosted by Paloma Health. We are an online medical practice focused exclusively on testing and treating hypothyroidism. We offer an at-home thyroid test kit, virtual consultations with thyroid doctors and nutritionists. We have a daily thyroid care vitamin supplement and a free mobile app that helps with diet and lifestyle modifications. So really end-to-end care for your thyroid, all from the comfort and convenience of home. This event is co-hosted by Mary Showman, who is a thyroid patient advocate. She's been advocating for thyroid patients and doing health coaching for decades at this point. She has a very good understanding of all aspects of what it means to live with hypothyroidism and be a thyroid patient and navigate the system. She's written a ton of books and is a wealth of knowledge, and we're really thankful to have her here co-hosting with us. So without further ado, Mary, I'm going to pass it over to you to tell us a bit about who you are and then introduce our speakers.
Thank you, Katie. I'm Mary Showman, and I am an author, patient advocate, and I have been writing and advocating for thyroid patients since the mid-1990s. So it's been quite a while. And I am excited to be here because this is an issue that is near and dear to my heart, the issue of pharmacy challenges and sort of fun with pharmacies that thyroid patients have. Because as thyroid patients, most of us are looking at lifelong treatment. So we are looking at having a relationship with a pharmacy forever. And it's an ongoing relationship. And so there's challenges that come up, price changes, brand substitutions, complications, all sorts of things. And so our two very special guests today are going to help us unpack and unravel some of these questions and issues that we're having with pharmacies. So I would like to introduce first Dr. Donna Mazzola. Donna is going to tell us a little bit more about herself and some of her interests in thyroid and some of her approaches to this. But by way of background, Dr. Donna Mazzola is a pharmacist who specializes in functional medicine and human nutrition. She's worked in many different areas of pharmacy and realized that her true passion was in the overall health and wellness approaches. So this passion became an obsession as she found out that some of her studies were conflicting with her core beliefs about health. So conventional medicine didn't have all the answers, as many people discover. And so she recognized the importance of bringing in balance with nutrition and medicine through her own struggles with Hashimoto's disease. So she has been there and done that. She currently runs the Dr. Autoimmune Girl blog to share reputable scientific information related to autoimmune disorders. And her mission really is to help all of us identify root causes of disease and create the balance between nutrition and medicine. So I want to welcome you, Dr. Donna Mazzola, to give us a little bit of more information about yourself and your interest in thyroid and pharmacy and how it all comes together.
Absolutely. Thank you for having me. Thank you for that wonderful introduction. So as you said, I am a clinical pharmacist. I found myself when I was in clinical practice, my greatest struggles as I was communicating with patients is recognizing the gap in understanding nutrition and managing their disease. And these were chronic diseases, like diabetes and hypertension and things like that. And there was no concept of how nutrition plays a role and really looking at the holistic approach, right, to managing disease. And it really hit and kind of came around full circle when I was personally diagnosed with a chronic condition, right? So in 2015, I was diagnosed with Hashimoto's. And, this was coming at me, it hit me like a ton of bricks. Because I thought I was otherwise healthy and I lived a healthy lifestyle, and I couldn't understand how someone who was, at least what I thought by definition was healthy, could get an autoimmune disorder. And unfortunately in pharmacy school, We cover lifestyle interventions with other chronic diseases, but not so much with autoimmune conditions, and even just, thyroid conditions in general. And so that's what led me down this rabbit hole of discovery. And so I went back to school, obtained my master's in functional medicine and human nutrition, ultimately with no vision in mind, but just to educate myself, to take control of my own health. And so with that, I started sharing that information out there in order to help others to be empowered, to better understand how to gain control. And, and initially, yes, it did start with thyroid patients because I could relate, but then realizing that this applies to every chronic condition. And even if you don't have a chronic condition, all these factors that I talk about and share really just apply to preventative health overall, right? And mitigating the development of disease and really getting down to the root cause of why are they actually happening and what are we intaking and exposing ourselves to that's causing this epidemic of chronic disease and autoimmune disease, especially Hashimoto's being the number one autoimmune disease to develop and, proliferate in the way that it has. And so that's been my mission through my blog, Dr. Autoimmune Girl, and most recently with my release of my latest book that focuses on, foods that impact the immune system. And really, again, getting down to that root cause of disease of what are we doing to cause this rise in autoimmune disease development.
Okay, thank you, Dr. Donna. Our second guest today is Dr. Jessica Nuhavandi. And I have had an opportunity to speak with Dr. Jessica in the past, and I have to tell you, she is an absolute powerhouse of information for patients about how to interact and deal with pharmacies. And that's because she is coming at it from behind the counter. She is the co-founder of Honeybee Health, which, if you're not aware of it, is a super popular online pharmacy. And she's a pharmacist, and she has really combined her interest in ethics, patient care, and passion to really bring a new type of patient experience to the world of pharmacy. So Jessica's got a bachelor's degree in bioethics and became a doctor in pharmacy, but then worked as a pharmacist in charge of an independent compounding pharmacy called MCP Pharmacy. Then MCP was acquired in 2017 by CVS. And so Dr. Jessica then co-founded Honeybee Health to bring that same degree of personalized hometown service and dedication to an online pharmacy. So she is leading the charge in the country for transparent drug pricing, and really has created a new type of pharmacy that doesn't require insurance, where patients can purchase prescriptions directly at cost. And frankly, just from experience, I can tell you, oftentimes you pay less at Honeybee than you do when you're paying a copay at a traditional brick and mortar pharmacy. So Jessica, I'd like to welcome you to our speaker series and give us a little bit more background and information about your interest in the topic of thyroid patients, pharmacies, and the fun we have with all of it.
Yeah, thanks, Mary. Thanks for that intro. And Donna, you're amazing. And I'm excited to be here to talk to you guys. I think, I come from the angle of, how can patients stay consistent on their medication, afford their medication, get access to the manufacturers that they like and want. And my passion for just coming at it from this angle really started at the independent level, where I realized that, every single person that was coming in was having a different experience accessing medication and different insurance plans. Some people were out of pocket. Some patients were splitting tablets because they couldn't afford it. And so, thyroid patients are, as you mentioned, Mary, this is a patient that is coming to us long-term. So we build relationships over time with them. And to see them struggle on their insurance covering a certain manufacturer or being able to afford the copay is really hard, when you get close to somebody, especially. So, that's kind of where it all started for us as a whole, not just with thyroid patients, diabetes patients, hypertension patients. It's everybody's kind of going through the same thing, where it's how do we get access to affordable pricing month over month that doesn't change, and to the manufacturers that we like and we know that work for us. And as we know in the thyroid community, that's especially important for our patients to stick to what works for them. And so, yeah, we started Honeybee with this idea that we would bring transparent drug pricing, to not a coupon, not any of the other things. It's like we're an actual pharmacy. You can go search your drug pricing while you're at the doctor's office, and see what it is and have consistency month over month. We're also one of the only pharmacies to allow you to choose your manufacturer. And that's because we don't take insurance, and we don't allow the insurance companies to dictate, what we have to dispense. And so we're able to help a lot of people get exactly the medication that they're looking for.
Great, thank you. So we have two different perspectives from two very, very experienced pharmacists who are coming at it from the sort of holistic approach here, because we can look at it from the health, nutrition perspective, and from, right in the trenches in terms of filling those prescriptions and trying to make sure that people can afford their medications. So we came up with a few questions from the Paloma side that we wanted to ask our expert speakers. And again, as Katie mentioned earlier, when you've got questions, please pop them in the chat, because Jessica and Donna will be available to answer some of your questions live once we get through our couple of questions that we have. But I want to get started with question for Donna. Thyroid patients are often told that their medications are what's called in a narrow therapeutic range. And patients don't always understand what that means. So I'm wondering if you can explain what it means when a thyroid medication or thyroid hormone replacement for hypothyroidism is a narrow therapeutic range drug, and why it is so important for us as thyroid patients to understand this.
Yeah, that's a really good question. And so what it means to be a narrow therapeutic drug is essentially the easiest way to put it is that the smallest change can make the biggest difference. So if you miss one dose of a particular medicine that's not under a narrow therapeutic window range, you'll be okay. We'll just say, all right, just take it the next day, things will be fine. For your thyroid meds, if you're not taking it specifically as prescribed and you miss a dose or you accidentally take two, that can cause a huge shift in the effect of the drug has on your body. And so that's why it's super important with thyroid medications. The key is consistency. So I tell patients, wait 60 minutes before eating or drinking anything when you're taking your thyroid meds. And so we focus on being consistent with that, and some say, well, I just take it and I drink my coffee right away. And I do that well, if you're going to do that every single day, then that's fine. But if you're not going to do that every single day, and some days you're going to drink your coffee right away, and some days you're not, then because of that narrow therapeutic index, you can cause shifts in the effects, in the absorption, and the impact that it's going to have, and really the overall benefit. I mean, if you're taking thyroid medication, you want to benefit from it the right way, but you don't want to lead to any safety concerns because you're not taking it appropriately as prescribed. And so it's nothing to be fearful of, right? So it sounds scary to say that, the smallest change is going to have this big difference. And, you could have these, concerns that would be drawn. The key is consistency. And as long as you're consistent with how you're taking it every single day, taking it at the same time, recognizing the interactions that can occur with the drugs, that's going to ensure the most proper absorption and ensure that your levels, as you monitor them, should remain the same. But one thing that I will say is that, kind of bringing in that holistic approach as well, while I'm focusing on how you take your medicine daily, as that will impact that narrow therapeutic index, also recognizing that outside parameters that also can impact your thyroid can also impact how the drug is working in your body, right? And so sometimes people will say like, oh, I've been taking it the same way all the time, and all of a sudden my TSH is elevated and things are not controlled right. Well, there could be outside factors as well, like stress, like dietary changes, things like that can also impact and have an effect on that narrow therapeutic index that we're looking at. So there's kind of like this internal thought process of it, but also consider the external factors that can play a role in that and impact the medication, and therefore, as a result, impact your levels.
Great. That's good information to have. Jessica, so let's talk about a story where we've got a patient that is taking Donna's advice and is being very consistent. So they're taking a medication and they seem to feel pretty stabilized on it. Their levels are looking good with it. And they go to the pharmacy and the pharmacist tries to substitute a different brand. So I'm on Levoxyl, but now they're trying to give me Thyroid, or I'm on NP Thyroid and they're trying to give me Armor Thyroid, or I'm on a generic and I know what it looks like every time I get it refilled, but now the generic looks different and it doesn't smell the same. It doesn't look the same. It's a different shape. What do I do when I'm stabilized on one medication, but they're coming in and trying to substitute for me for various reasons? We don't have what you need, or your insurance says they'll only cover this or whatever. What do we do? And why is that such a problem for some patients?
Yeah, it's a big problem. I think it's something that all pharmacists deal with, unfortunately, like day to day. And a lot of it has to do with PBMs and the way that formularies are set up and reimbursement for pharmacy and what they're able to source and dispense at a pharmacy level. Like a lot of it is out of the patient control. And that's hard for us as pharmacists because sometimes our hands are tied. But I think the main message here is that you have a voice as a patient to say like, no, I don't want this. I want what I was taking before. I think a lot of people go to the pharmacy thinking that it's their only option. It's their only choice. And that's not the case. You can say, hey, I want to take this specific manufacturer. I want to stay on the medication that I've been taking for the last 2 years. I don't want to substitute. I don't want to change. And it's important to speak up and have that conversation with your pharmacist as well. I think a lot of people go home, realize that it's different, and then say, well, I'll give it a try. And then lo and behold, like they're not feeling well the next day. So it's really important to know what you're taking, know what it looks like, know what your levels are. And like, if it's working for you, then stick to that. And you always have options. And, one of the things at Honeybee is that we don't take insurance. And so you have the choice to choose what you've been taking. And so if something isn't covered by insurance, that doesn't necessarily mean that it's going to be an extraordinary cost, right? We have options now. So you can go to Honeybee and you can check the price of the manufacturer that you want to stay on. A lot of people think like, well, if my insurance isn't covering it, then I have no choice. That's not true. Oftentimes paying out of pocket can be less expensive, to your point, Mary, than actually paying for the copay. And it keeps you on your medication. The biggest thing for us as pharmacists is continuity of care. Like Donna also referenced, it's like, we want you to stick to what's working for you. And it's different for everybody. What works for you might not work for somebody else. We know that, especially with thyroid patients, is like, this is your journey, like figure out what that thing is that works for you. And we want to help you stay on that medication. And so speak up, talk to your pharmacist, know what you're taking, know what color it is, what shape it is. And speak up. There's always choices.
Well, this brings up a question that I have for Donna, because, Jessica's talking about generics and substitutions and different brands and things. And one of the things that we know in the thyroid space is that from medication to medication, from brand to brand within the levothyroxine area and the various generics, because there's numerous different generics, part of the problem that patients are having is due to different fillers and ingredients. So we have some of them that have acacia, some of them that have lactose, some of them that have certain kinds of dyes and things and colors that add some problems. So Donna, can you tell us a little bit about why do different dyes or different fillers or things like acacia or certain ingredients have reactions in some people that don't in others. And so, I mean, and how does that affect whether or not a particular formulation works fine for me, but maybe not for you because you're sensitive to one of the fillers or the ingredients?
Yeah, that's a great question. And it goes back to, and we're all individuals. And what works for me is not going to work for you. Maybe it will, but it may not work for the next person. And so I think, and honestly, in the beginning of my career as a pharmacist, I really never thought about the impact of these, the minuscule amounts of fillers that may be put in or dyes in these medications. And I will just give, even from like a personal experience, they make a big difference. And even in managing my own disease, I have found that the products that have the least fillers and ultimately are the cleanest is where I respond the best. And I have greater sensitivity to things like lactose, to gluten that's found in these products. And we're not really taught that, right? To that level of detail in pharmacy school,
Yeah.
that these can make such a difference for patients. But again, it goes in every brand, every generic, the manufacturers, the fillers in them are all different. Now you can get that information and be privy to it and better understand, there are products out there, currently that, and I don't know if we want to mention any product names, but there are products that are cleaner and that do have absolutely no fillers. Like I know, Jessica, you said you worked at compounding, right? Like you can get products compounded completely clean of no fillers, strictly with the active ingredients. Or at least fillers that wouldn't have or pose any kind of risk. And so it is incredibly important, because I will speak to myself when I was on a particular product and then it was, pulled from the market because of potency issues and was switched to another that ultimately should have been equivalent from a dosing standpoint. From a inactive ingredient standpoint, it was certainly not equivalent. And I couldn't get under control. And so it's important to recognize that. And I think that that's something that's not communicated broadly. It's more that, they're interchangeable, it's the same dosing, but they're not interchangeable per each individual. And I think what's important is just to, number one, understand that and be in tune with your body and recognize, if you do have to make a change, when you do, monitoring those levels, recognizing how you feel, how your response is, to better determine what could it be within those products that could ultimately be impacting you feeling good and feeling healthy again. And so I think that there's that onus also on the patient. It's on you to also recognize that and report that, right? So that's again taking ownership of our health, but recognize that, report that to the pharmacist. That's your perfect person that you have access to, that can look that up, that can inform you of what inactive ingredients are in these products, so that you can then make that informed decision and take that back to your provider to identify what's the most appropriate product for you.
Great, thank you.
Can I tag onto that real quick and say
Please.
that actually at Honeybee, we spent a lot of time on this feature where you can look up a drug and it'll actually tell you if there's lactose, gluten, dyes, all that good stuff. So you can actually go on our website, search any medication, and it'll tell you if it has those ingredients inside of it. So it was like really important for us to be able, especially for the thyroid community, for them to be able to see those types of things. So that's something that we offer. If you just go on the website, you can see that.
Well, and that also raises another question, Jessica, too, because as we were discussing here, the issue of generics is a challenge for some thyroid patients, because I think people need to understand there are brand names of different drugs, like in the thyroid, levothyroxine, the synthetic, we have Synthroid, Levoxyl, Unithroid, Euthyrox. Those are sort of the main brands. And there's the Tirosint liquid and Tirosint capsules, which are not in the tablet family. And then there's a bunch of different companies that are all making generic levothyroxine tablets. And it's like the same general main ingredient, but the recipes for each company are different. And one of the things that patients don't know, and maybe you can explain to them, how does it work? If I have a CVS or a Walgreens or a Costco pharmacy or whatever, and I'm on a generic levothyroxine 100 micrograms. Every time I go in for a refill of my generic levothyroxine, what's going on behind the counter at the pharmacy?
Mm-hmm. Yeah, I think again, it goes back to like, you have the power to say what you want. And I think a lot of people don't know that. When they go to the pharmacy, they just take the bag and go home. And it all depends if you're using insurance or if you're paying out of pocket. I think that's really where the line is drawn. If you're using insurance, what happens is there is a formulary, and it depends on what the pharmacy has in stock and what they're being reimbursed. So what's happening is that when they're processing a claim, it's saying this month we're going to cover this certain NDC, which is the National Drug Code. Like it's basically like the social security number for a drug. And they're saying that we're going to cover this one this month. And so even though, Mary, you use this analogy, but it's like cake mix and then cake. It's like, it's the same active ingredient, but there's lots of other things in there. And so it seems like it's equivalent, but it might not be for you. And so if something is working for you, know it's working for you. And you go to the pharmacy one month and it looks different, but they say, nope, that's the same thing. It's just another generic. You were on a generic before. Now you're on this is another generic. And you say, well, I don't want this one. I like the one that I was taking before. And they're like, well, your insurance doesn't cover it. It's not the end of the road. You have options. You can pay out of pocket. You can ask what the cash pay price is. You can use coupons, or you can use a company like ours where it's direct pay and you don't have to worry about any of that. And so, like, I think, again, the main thing is you have a choice. Sometimes there's things happening behind the counter with insurance and formularies and PBMs that is way too complicated to go into in this conversation, but it's a lot of times it's outside of the pharmacist's hands. It's outside of the pharmacy as a whole, what they're carrying, what they have access to from their wholesalers. But you have a choice as a patient to say, like, I want to stick on to this specific manufacturer. So there's a lot going there, but you still have choice in what you're taking.
Well, and I think people need to understand that when you go and get a refill, if I go to my CVS or my Walgreens to get a refill of generic, they're going to refill it with whichever generic they have in stock. And that may be based on they got a good price this quarter on this particular generic over the other. The one I had last time is gone up in price a little, so they're getting a different source. And what people also don't know is that they can vary in potency. Even the same dosage from one manufacturer of a generic to the other can vary in potency up and down 5% on either side of the total potency. And like you said, one can have gluten, one can have lactose in it, but I don't know which one is which. And if I don't know which one I was taking before, they can give me anything and I'm not going to know. So I think one of the things that's really incumbent upon thyroid patients is if you're on a generic, find out which manufacturer is the one that's working best for you, and then do your very best, whether it's through a relationship with a local pharmacist or through a relationship with a pharmacy like Honeybee, to make sure that you're staying with whatever either brand name or manufacturer specific generic, because switching from one to the next every time you get a refill is a recipe for a disaster.
There's not a lot of, like, the science community hasn't done a lot on like allergic reactions on fillers and things like that. There is some things, but there's not a lot. But anecdotally, we know as pharmacists that, like some medications some brand names will cause headache, and other, like the generic won't. It's just like, it's different for every single person. So you really have to know what you're taking and stick to what works for you.
Absolutely.
I'd love to add on, just to say
please.
that, especially those fillers, we talk about allergic reactions, but also if you have just sensitivities to them and you're a patient with Hashimoto's, I mean, there's just that underlying inflammation and that inflammatory response that can occur as a result. And that really could be what kind of triggers this flare, or you just, not responding as well, because you're also impacting the underlying disease course, right? With that inflammation being an autoimmune disease. So that's also of concern too. So if you have that sensitivity to lactose or gluten, and it creates this just inflammation in your body, that can lead to kind of an upregulation of your disease, your underlying disease state. And so that's just another aspect to consider, because some doctors will be like, oh, well, you don't have any issues with gluten or dairy, like this is fine. You don't worry about fillers, but there's a little bit more to it that we don't focus on.
Okay, thank you very much. Well, we went through all of our questions from the Paloma side, but we've got a number of questions coming in from viewers. So I'd like to go to those now. Our first question is for you, Donna. And one of our viewers wants to know, what are your tips for taking thyroid medication for maximum absorption? So how do we take our thyroid meds so that we get the benefit of what we're taking?
Yeah, so I recommend taking it. There's been several studies that have been done, and I've well versed in many of them, whether you take it at bedtime or in the morning. And I do my own personal experiments. So some people are able to take it at bedtime, waiting 3 hours after they've eaten anything, and have found that that's best absorbed for them. Where others, that's not the case. So I think you do have to experiment a little. Personally, what I have found works is taking it first thing in the morning. I know it's like on your prescription bottles and from your doctor, it'll say to wait 30 minutes. I recommend waiting 60 minutes before eating or drinking anything. And that includes black coffee. So that's one thing that I have reiterated time and time again, that, your coffee actually increases the transit time in your gut. So it can impact that absorption that's occurring if I know some people that actually take it with coffee, which kind of there's like a learning experience that goes on there. But waiting at least 60 minutes before eating or drinking anything, I mean, aside from water, other things that can be done is taking it with vitamin C, taking it with lemon water. So those are other options. And there have been studies that show, especially patients that have like an underlying gastritis, like inflammation in the gut. There's actually a study that was done where they took 500 milligrams of vitamin C along with their thyroid medication and found increased absorption. So at the end of the day, you can consistently take it how you want, but it's going to require higher doses, right? And so I always say with this disease, it's progressive. And so you want to be on the lowest possible effective dose for you. And in order to get to that point, it's kind of understanding these factors that we just talked about that will help boost absorption so that you can be on the lowest possible dose. And should you need to increase as the disease potentially progresses, then you have that broad window to do so. And so that's kind of my advice in ensuring that you're getting the right amount and taking it as prescribed.
Great, thank you. That's wonderful information. Jessica, we have a question from one of our viewers, and I think this is probably one that a lot of people could relate to. She says, I've never really thought about my pharmacy. I just go to the CVS and get my prescription filled. So what are the characteristics of a good pharmacy and or pharmacist? What should I be looking for or expecting? Because I think people may think I go to the gas station, I fill up with gas. I go to the pharmacy, they hand me a prescription, but maybe there's more that they should be expecting or deserve. And you're the person to tell us because you've been on both sides of the counter for this.
Yeah. That's a really good question, actually. And now that I'm on the online pharmacy mail order side, it's very different because our interactions with patients mostly are over email or on the phone. And we have, a lot of phone conversations. But if you're seeing a pharmacist in person, a lot of times a lot of people complain about like the chain pharmacy experience. And it's something that we talk a lot about at Honeybee as well. And what I want to make clear is that a lot of those pharmacists and pharmacy technicians are overwhelmed. Like it's a very fast-paced, heavy workload environment. And I feel like those pharmacists are always doing their best, sometimes don't have a lot of time to speak to you or check in with you, but that's really, really important. Like that is still part of their job and what they're supposed to do with you. So, the first thing is like, see if you can create an interaction with your pharmacist or a relationship and get to know them. And they should be checking in with you on how you're feeling too. When you're coming for your refills, it shouldn't just be like, hey, here's my refill, I'm out. It's like, how are you feeling? How are you doing on this? Are you taking it at the right time? And when you're first picking up your first script, they should be going through a consultation with you and telling you how to take it, just like Donna did, and going through an in-depth kind of like conversation with you. And that's really, really, I think what's most important to do with the pharmacist is just have a conversation so they know who you are and they'll remember you. Like, you might think they won't, but they will. And as far as like what we do at Honeybee, we have the 800 line that we have open 6 days a week. And so anybody could call in, even if you're not a patient of ours, and just speak to a pharmacist 6 days a week and talk about your medications, ask questions. Like, that's what we're here for. That's what the pharmacists are here for. I think we used to be the most trusted profession, healthcare professional. I'm not sure if we're still ranking that high anymore, but we're there. We're a free resource for patients to, speak about their medications. And oftentimes, like, we sometimes know more than the prescribers about the medication. We are the medication experts after all. And so having a relationship with your pharmacist is really, really important. So yeah, I think it differs whether you're going to use online pharmacy or whether you're going to go in person. But at the end of the day, you can still have a relationship with your pharmacist. That's the most important thing. And if they're checking in with you, then that's a great pharmacist.
Great. That's good to know. Now, in terms of relationships, Donna, what are your thoughts about how pharmacists and physicians work together, or maybe not? What is that relationship like from your perspective?
That's a challenging one. So, and not every situation. I mean, in the ideal world, a physician would diagnose and a pharmacist would prescribe. And physicians are wonderful diagnosticians, and pharmacists spend 4 years studying the ins and outs down to the chemical level of every single drug. So sometimes it's kind of mind-blowing that we can't prescribe, given how much we know in our knowledge. But in those situations, I'll be honest, like, that's in my previous practice, that is how I worked under collaborative practice agreements, where I worked very closely with providers, where they did diagnose and they come to me, they would consult and prescribe, or I would review, make changes, and we would make adjustments. And it was a great marriage that we had. Unfortunately, that's not always the case. And there's not, some providers don't trust, right? They want to manage their patients in the way that they want to manage them. And they don't want the input of another healthcare professional. And, sometimes it's just, as a pharmacist, those are hurdles we have to get over and get past, right? And do what's best for the patient. But at the end of the day, I think what's most critical, especially if a patient has a relationship with both, is the patient also advocating for themselves, right? Recognizing like, your pharmacist there is also to educate you and is knowledgeable about your medication and is knowledgeable about what, other alternatives that maybe could help, things like that. Take that knowledge and advocate also for yourself with your provider. And I think sometimes that having that as the middle ground helps. Certainly as pharmacists, we'll contact providers and have those discussions, but if it doesn't go as we anticipate, then of course, I always empower the patient. It's your health, it's your body. You're empowered to be knowledgeable and take that knowledge and ask questions.
Mm-hmm. Jessica, did you have some thoughts to add to that? Because I know you were sort of laughing at the beginning about the discussion of doctors and the relationship.
Well, I'm a big proponent for pharmacists as provider. We need to move towards pharmacists being providers, having provider status, and getting reimbursed for more of our services. Like what Donna does is part of a collaborative agreement. Like, lots of pharmacists want to do that. It's just very difficult at this time sometimes to set something like that up. We don't have the resources and we don't get paid to do that. We don't get reimbursed for the time that we spent with people. So, what I'm always advocating for is pharmacists as providers and being reimbursed for the services that we do as well. And after all, we are the drug experts, and doctors and PAs and all, like, other practitioners are very good at the diagnostic aspect and seeing patients. But at the end of the day, we are the drug experts, and we should be allowed to have a say in what is being prescribed. And I think sometimes we'll call a doctor because we think something isn't right, or based on our conversation that we've had with the patient that maybe the patient hasn't had with their provider because maybe they weren't comfortable in that setting. We'll call the provider and say, hey, like, this is what I've learned, and maybe they're not doing as well as we all think they are. We're like, I would like to recommend switching to XYZ or whatever. And we won't always get a favorable response. It'll be like, well, thanks, but this is what we're going to stay on. And oftentimes we can't do anything about it. And that's the horrible part. But again, it comes down to the patient taking control of their own healthcare and saying like, no, can you call them back and say, I want to change it myself? Or they can call the doctor's office themselves and say, my pharmacist just called and I'm not feeling well, whatever it is, but patients have to take more control. So yeah, that's my 5 cents on that.
Okay. I actually have a question here that seems it's a sort of a practical question that you might be able to answer for us, Jessica. What if a patient loses their medication? So let's say, you open the car, your pill bottle rolls out and down the street, or somehow it gets lost someplace in your house, or you drop your last pill in the sink and it goes down the drain. What can we do when we lose our medication? Can we get a refill from pharmacists? Do we have to go through the whole process with our doctors? What kinds of mechanisms are in place to help patients when they've lost their meds?
Long story short, that's a difficult question because it depends on each person. If they have more refills on file, that's something that we can easily do, and then we can get a new prescription later from the provider, so we don't waste any time, any gap in treatment. This is why at Honeybee we don't take insurance, because you as a patient have the autonomy to say, hey, I want my refill early because I left it, on a trip, or I didn't. And we don't have the restrictions that insurance companies put on us to say, oh, this is an early refill, you can't process it. And so that's why we don't work with insurance, because it allows the patient more freedom, not only to get refills if they lose a medication, based on this question, but also if they want to get a 90-day supply. That's often harder for patients to do through insurance as well. And at Honeybee, you can get up to a 90-day supply, no problem, if that's what your doctor wrote for. But yeah, it just depends on if you have refills on file, or how easily we can get in touch with your doctor. But oftentimes you can just go to the pharmacy directly without having to go through the whole process of talking to your doctor again.
Okay. And one other sort of practical question. A lot of patients have been complaining, myself included, because different thyroid medications have been recalled. And recently it's been pretty much frequently happening in the natural desiccated thyroid arena. And so what can a patient do, or what steps would you recommend a patient take when a medication is recalled?
I think first it's when something's recalled, sometimes it's not every single lot number. Sometimes it's just certain lot numbers that are recalled. And so make sure that what you're taking, you can call your pharmacist and say, hey, is this what you dispensed to me? Was this something that was part of the recall? You have to ask the questions. And then, then honestly, what it comes down to is, since we aren't allowed to write the prescriptions ourselves, if you have to switch to something else, it's oftentimes our patients have to go back to the provider, have the conversation, get a new prescription, and then come back to us. So it's this big round loop again, where they have to go back. But that's what happens when something gets recalled. We can't make the decision without your provider being involved.
Okay, thanks. And now I have a question, and I think I'd like to have both of you weigh in on this, Jessica and Donna. One of our viewers wants to know why some people seem to do well on natural desiccated thyroid, even though it has a different ratio of T4 and T3 than the human body does. And I'm wondering if that's something that either one of you feels like you'd like to weigh in on or share information about.
Do you want me to start? I can start.
Yeah, you go.
Yeah. So there's so much controversy around the natural desiccated versus synthetic thyroid hormone alone. And, there's like a long-standing history, and I just talked about this recently on my blog of, those were the original medications, the T4, T3, natural desiccated thyroid. What's important to recognize is, number one, I think the question is, why do some people do better on desiccated versus the synthetic? And that has a lot to do with conversion. And so the human body, looking at T4 to T3 ratios, I think it's about 12 or 13 to 1 in the human body, T4 to T3. Now, T3 is your active form. T3 is the one that's, uptaken by the cells. I always tell people that if you continue to be symptomatic, despite normal levels, it's likely your T3. So that's the hormone, that's your active hormone. That's the one that's going to impact and actually have a reduction in symptoms and how you feel. And so we should, in a perfect situation, be able to convert T4 to T3. And sometimes people have conversion issues, and they're not able to convert adequately from T4 to T3, or maybe it's related to micronutrient deficiencies that they need in order to help that conversion. And so therefore they may do better on natural desiccated thyroid, because then we're giving a touch of T3 in the active form and not depending on the body to convert. And so I think that recognizing that is a critical aspect of it. Now, in regards to ratios, I know like the pig ratio, it's 4 to 1 versus a 12 to 1. And I think the question is, why is it? Why do people do well?
Yeah.
There's still a need for that. Like I said, you do well because there's a need for that active T3 form, regardless of that ratio is. It's recognizing that there is the body's inability to convert from T4 to T3 and have that active hormone available. So the need to supplement it is what's going to have that impact on how you feel. And so some people take Synthroid for years and feel awful and never know why. And it's not until they're switched and they have T, and some people even have like synthetic T3 that's added on to their formulation, right? And it's just a matter of, if you recognize that there is that inability to convert, and that's a matter of doing broad testing, to understand how the body is handling thyroid hormone and where there may be deficiencies, to then better understand and individualize what is necessary to supplement with from a thyroid hormone standpoint, whether it be T4, T3, what ratios are necessary. Again, it's all individualized.
Great. Jessica, did you have any thoughts about this as well?
Yeah. I mean, I'll just add that sometimes, like, if patients have a pre-existing stomach issue, like if you have like gluten intolerance or another autoimmune issue, like your stomach may struggle to absorb the medication. That's something, but honestly, it's really very patient specific. The question is, why do some people do better? You could be struggling a little bit right now and think, oh my God, maybe I should switch or something like that. But it's very, very patient specific. There's lots of patients who do very well on synthetic and there's some that don't. And so it's really, it's a very subjective question. I think it just depends. You have to figure out what's right for you, do the testing, like Donna said, and figure out what's right for you.
Yeah, and I'll add too that it's really in its infancy, but there are actually genetic tests where if you look at particular SNPs on the genes, you can find a propensity to convert too much T4 into reverse T3, or difficulty in problem converting T4 into T3. So there's a whole subset of the population that has genetic mutations or polymorphisms that make it impossible for them to do well on only a T4 medication. So we have nutritional issues, as Donna knows so well, and we have genetic issues. And so there's a variety of different factors that I think are all coming into play. Jessica, we have a question here from one of our viewers, wants to know if Honeybee does compounded medications.
Yeah, so currently we don't do compounding, but we're really excited to announce that we'll be launching compounding next year. So we're working to get that off the ground.
Fantastic.
Yeah, we know that's a big need for our patient base. I think 65% of our patient base is female right now. So we do have a large women's health group of people that are taking women's health medication. So we're also going to work to do hormone replacement therapy and other compounded products, and thyroid will definitely be one of them. So we're working hard to get that off the ground in 2022.
Terrific, terrific. And just to raise the question of compounding, I mean, one of our viewers, Cal, wanted to know, what do you do when your medication, your armor is out of stock? Because right now we've been having problems with armor supply and NP thyroid, and then the Nature Thyroid and WP are both on hold right now. And frankly, I guess they got to go to a compounder, right?
Yeah, or you can, there's some pharmacies that still have stock, or like when something just goes out of stock in like one place that you normally go to, you can always check with other pharmacies as well. And so oftentimes, because we have, like at Honeybee, we have such a large patient base, we often are buying more inventory than other places. So we might have, inventory still in stock. So I'd say like shop around for sure.
Great. Well, and I have one more question that I'm going to throw out to Donna, but I do want to mention here for the folks that are not familiar with Honeybee, that when you hear about a pharmacy that doesn't take insurance, you're probably in your mind have visions of huge bills and price tags and things. And I can tell you that I've had some of my coaching clients do comparisons on their copays or their cash prices at their local pharmacies compared to the Honeybee prices. And almost always Honeybee is coming in with a better price. So it doesn't always have to be, your copay is going to be the cheapest option, because, you can get 3 months supplies of things at Honeybee and it works out to be less than your copay from your insurance company. So I just wanted to put in that plug for it, because I think it's a really good option for people.
Thank you.
And Donna, I have a question for you that I want to wrap up with, and it's sort of not completely a pharmacy question, but it sort of ties into your area of expertise, and that is, there are a lot of thyroid patients who really have a very holistic view of health, and they like things natural, and they're, maybe they're gluten-free, and they're maybe vegetarians or vegans, and they stay away from hormones and pesticides, and they're really trying to do everything as cleanly as possible. And I have heard so many people say, I don't want to take thyroid medicine. That's not natural. Or why should I take pills? I should be able to do this with food and diet and lifestyle changes. And, can you differentiate? Because I've had some challenges with some of my coaching clients where, they don't even have a thyroid gland. They've had it removed surgically. They can do all the natural things they want, and those are going to be wonderful, but it's not going to replace the need for the medication. Whereas for some people, maybe lifestyle can nudge them back into the range. So can you just address that issue of people that are adamantly saying natural only, no pills?
Yeah. Yep. And so it goes back to my mantra, right? Balance, nutrition, and medicine. And medicine is not bad, and sometimes you need it. And what I like to always explain, especially when it comes to the thyroid gland, is that it takes approximately what studies have found, 8 to 10 years to actually be diagnosed, right, with an official condition. So in that 8 to 10 years, there has been damage that has been going on and being done to the gland. And sometimes that damage is irreversible. And as a result, you will need to supplement with medication. But in addition, taking those measures to mitigate any further progression and damage to the gland. And so unfortunately, you need the medication. I'm one of those people that wish I could be without it and didn't have to take it every single day, but I do. And I've come to terms with that, and I need it despite every single other measure that I put into place to mitigate again that progression. And that's critical. And if you don't have a thyroid gland at all, where are you going to get the hormone from? I mean, your thyroid is your metabolic powerhouse. It's that balance, like kind of like central to your whole body. It's this little butterfly gland that's imperative and affects so many aspects. And so if you don't even have that gland to produce that hormone that's going to impact those effects on a cellular level, you must supplement with that hormone in order to get that effect. But again, what's terrible is that people look at it like it's such a horrible thing, or they've done something wrong, or they're failing at their disease. And that's not the way it needs to be looked at. It's honestly, it's just a balance between the two. You have your medication and bring in that holistic approach, and you'll feel the best that you're going to feel. I do it every
Wonderful.
day. Trust me.
Thank you. Well, we are coming up to the end of our hour, and I feel like we could have talked for another hour because there's so many interesting things related to this topic. But I would like to thank Dr. Donna Mazzola and Dr. Jessica Nuhavandi. And we have information in your chat. Honeybeehealth.com and drautoimmunegirl.com are the websites where you can find both of them. And we will be putting out an email, I believe, with additional information to everyone who attended today. But I want to thank you both for joining us. You have been incredibly valuable, and you've got so much wonderful information to share. And I hope we can have you back on the speaker series at some point in the future. And I'm going to turn it over to Katie to take us to the final part of the show here.
Sure. I don't have much to add other than a big thank you to all three of you, Mary, and to both of our speakers for joining us. I'm obviously hearing themes here between like create a relationship with your pharmacist and take back control of your own health, like advocate for yourself as a patient. And there are professionals like pharmacists out there that want to help and want to be in partnership to help us feel better. Very informative. Thank you both for your time. And thank you to everyone who joined us. Like Mary said, we will send out a replay in the next 48 hours or so that will include a link, obviously, to this replay and also where to find Jessica and Donna and more information about what they're up to. So thank you very much, and we will see you next time.
Thanks, everybody.
Thank you.